Good morning. I see we're still networking. Come on down. Y'all want to sit down? Good morning. How are you doing? So welcome to the Amazon campus, and welcome to our second annual Not-for-Profit Summit, which now we're saying Imagine Making the World a Better Place. And my name's Teresa Carlson. I run Worldwide Public Sector for Amazon Web Services. So welcome. It's great to have you guys here today. So last year we had our first inaugural event in London. Who was with us last year? Raise your hand. So we have a bunch of new people. This is really exciting. Wow. So we've tripled our event since last year. The team was about ready to kill me last year, about 3 months before I said, we're going to do a not-for-profit summit. They're like, what? And so this year they did a much better job, being much more proactive. And next year I've given them a target of 1,500 people. And we want your feedback on where we should have the event next year. We'd really love your feedback on what's the right city, where would you like to see the location, and anything more specifically that you think could make this event better. But we've grown and we're excited and we want to continue to grow. And in fact, my team this year told me I needed to go to Skull, which is in Oxford, England. How many people have been to Skull ever? Okay, good. I see a few people. I know. Hi. And it was really interesting. And I really enjoyed it. But there was something I felt really missing from that event, which was technology infusion, and how technology is really utilized in a way to drive the mission. And what we want to do is really make this event much more about sharing how technology infusion can really drive the mission, more mission for the money, be able to really power what you're trying to achieve, be it through direct mission, marketing, fundraising. So we want to, like I said, continue to get your feedback on that. But we feel really blessed to have each one of you here. You're our partners, you're our friends, you're our customers. And we really just want to make sure what we're providing here is something that you guys are going to walk away really excited about. Our not-for-profit business is fairly young. We've about 4 years now, Marco, right? So we're still young and we're still looking for advice on things that you really need from us to make things move. And not just AWS, but Amazon as a whole, Jeff and the entire company, we're really committed to the not-for-profit space and philanthropic work that's required around the world to really do great things. And we want to be able, for this event, I'll talk about it in a little bit, but we're going to try to bring the full power of Amazon to you for this session and let you get to know some of the other groups within Amazon. So today and tomorrow, you'll hear from different Amazon leaders and get to understand their business model and how hopefully you can take advantage of that. So I really encourage you guys to network, get to know people, spend time. I love this sort of casual back little tables. People are sort of communicating, but I really encourage you to share best practices and ideas. And then, so let's talk about what we're doing here. How can the world be changed? How do we create an innovation ecosystem, and how do we really work together to make the world a better place? And how do we really bring that momentum together? It's interesting because every time I get to hear and talk to our customers in the not-for-profit world, I'm always blown away about what you're doing, how you're doing things. And what we really are striving to do here is we want to be able to not just imagine, but make a world that's real, where where everybody has food, everybody has clean water, we can get education to everyone, make it available, make medicine and programs available of need around the world, make sure there's no place around the world where humans are exploited and their dignity is raised high. So if we can do that together, if we can really do that, we're going to be solving some major problems. And I see that in the works that you guys are doing. So let's uncover that. Let's share those best practices. Now, I show this slide. I'll sort of probably maybe hit it. I showed this slide, and I'll just jump over this real quickly. We have Tens of thousands of customers around the world. We continue to scale, but one of the numbers I'm really proud of is our not-for-profit business and our partnerships. We continue to drive our not-for-profit customers and build that ecosystem. And the reason we think this is really important, the more not-for-profits that we work with, the more that we can come together and share what you're doing and understand and build the services around your needs. We just did our AWS offsite a few weeks ago. We actually spent a lot of time talking about this community and things that we should be supporting to better help you guys, like a marketplace concept, or the team has come up with some new ideas around technical capabilities that we could bring a volunteer core together to help you on technical skills. So we have a lot of things in the works that hopefully will help. But at the end of the day, we want all these things to translate into something that's actually advancing the mission around capabilities of education, government, ideas, medicine, health, environmental, agricultural, so things that are really, again, improving the mission. So let me tell you, there's so many great stories, and you're going to hear from so many of our customers, but let me just tell you a few stories that I'm excited about. One is Thorn, which is one of our customers who's doing incredible, inspiring work, and they developed a technology-based solution to combat human trafficking and exploitation with a focus on children, sexual exploitation. And I'm on the board of ICMEC, so the International Center for Missing and Exploited Children. And in fact, just this year at our public sector conference, the team in Washington, my team, put together a Combating Human Trafficking and Exploitation Forum. And we want to continue this, so we want to ask you guys to join in on this, to help us with this. But this particular solution is really interesting because it uses natural language processing to identify both the children that are with their handwriting analysis, because many times they're asked to do their own ads. So their exploiters are saying, write your own ads, because supposedly it's less of a criminal offense, if you can believe that. And then they also, so through the handwriting analysis, we can determine through natural language processing potentially who that victim is by sharing that information with federal and state law enforcement officials. And then also working to understand who is the child and who is the abuser. So it's those kinds of things that we're doing. And it's now being used by over 3,000 officers in 50 states, and it's finding 5 children per day, 60% faster, right? Is that not good? Yes. We need more and more and more of those kind of things. So these are the kind of solutions that we've got to solve. And we're really excited about our partnership with Thorn, and the CEO, Julie Cordair, was there and talked, and we need to continue just to work together on these solutions. The other one is Just Giving. How many of you know of Just Giving? Who's in the audience from Just Giving, hopefully? We have some folks, good, I know you're here somewhere. This is truly a technology that helps folks scale. They're the #1 online platform for social giving, and they consider themselves to be sort of the research and development for every cause around the world. And I think they've done $4.5 billion on their platform for raising money. And in fact, when they drive solutions like the ALS Ice Bucket Challenge, and their website scales, you never want it to crash. Nancy Brown and I have had this conversation. You never want your fundraising site to scale and crash. You want it to scale and keep scaling. So they now run their solution on AWS, and they don't have to worry about crashing. But when like ALS Challenge happened, they had lots of issues around crashing the website. And I was telling the team, I actually hosted our Amazon All Hands, company All Hands a few years ago. And Jeff did the Ice Bucket Challenge, doing our All Hands. So hopefully it didn't crash after that, but I know all the Amazonians went on and actually gave money. But again, they have 30 million users, again, powering a $4.5 billion platform for giving. So now they can support increased trafficking, their traffic around what they're doing for fundraising. And this is what we want each of you all to be able to do on your fundraising site, is make sure that it never fails you when you're going out. Because again, it can cost you a lot of money if your site goes down. This is one of my absolute favorite stories. Digital Divide Data is one of our partners, and they're an organization that we're working with that's truly global, and they are investing in the first cloud center of excellence in Kenya, and they're doing workforce development program for teaching in-demand AWS cloud skills and coding skills to young adults. And we just put through our first class, 6 months of training. 97% of these students, 30 of them, passed. More than a third of them had no technology experience at all. And they passed for AWS sysadmin. And I just had one of the team look up what is the average salary for an AWS sysadmin. It's $111,000. And on average in Kenya, people who are educated make $2 a day, a month, something like that. I mean, it's like unbelievable. So think about what we're doing. So we found a model. So we work with Digital Divide Data. And what they are doing, not only did we get them certified, but they have a job. And their job is to archive the Kenyan African National Museum. And we've done this in partnership with Intel Corporation and Digital Divide Data. And the thing I love about this, the Kenyan National Museum, they're going to digitize and preserve the countries in Africa, one of the world's most important artifacts of human and technology evolution. And this is housed, today there's nothing virtual, and a lot of these artifacts are decay. They're in decay because they've been sitting there for years and years, and now we're going to make them digital, and all these students are doing that. So it's pretty exciting, and we're providing them career opportunities. So we're going to do more and more and more of this, but we think, this was our pilot, we think we found a model that's actually working, and we're going to continue to do this. And we have a little video that we want to show you about this. So if you could roll the video, please.
The National Museum of Kenya is a custodian of Kenya's natural and cultural heritage. Kenya has been christened the cradle of mankind because of our extremely rich fossil record. It's unparalleled anywhere in the world.
DDD is a 15-year-old social enterprise providing IT services to companies across the world. As a social institution, we are providing employment and education to disadvantaged youth.
Technology is fit for any person. We are all capable.
My passion is writing code and database administration.
My desire is to see our knowledge, our understanding about human ancestry, reach out to as many people as possible.
Through our engagements with Amazon and Intel, we had the idea to use the Amazon cloud to digitize their artifacts. So we created the AWS Academy for Kenya.
Our students digitize this content, provide web development, content management. Knowing this technology is going to elevate their career.
This is a dream come true. Conservation in the virtual museum created with the hands of Kenyans themselves.
The social impact of our work is not only helping one individual,
it's adding value to not only the nation, but to the rest of Africa and also the world.
Yay! There's the digital Frank and the team. They were my host at Skull. So I love this story. I mean, think about this. And I have to just tell you, Frank called us up. I will never forget this. And I knew him. He was a colleague, former CSC. This community is so small. That's the thing I love about it. We sort of hang together for many, many years. And we call each other up. And I know that's the way the not-for-profit community is. You really work together and hang together. And Frank called us, and you know what he said? He goes, look, Teresa, he said, we thought about this as a group. And we said, what are skills that are really needed? And we said, cloud. And he said, I told the team we need to bet on AWS. And we need to utilize AWS, get them to work with us, and train and educate these students in cloud. That's the future generation. So again, a technology guy that has spent his entire career in tech and said, what's the future? What do we do to help Africa move further faster? So I'm really excited about this program. We want to recreate it everywhere. And think about it, 6 months blocks of getting people trained, and then this is just the beginning. We can continue to add new skills on top of that. Super exciting. And then I just have to share, yesterday I met with our customer in Bahrain, and they talked about 60% of their students in computer science are female. And I want to get more females in diverse populations. And they're smart and they're doing great work, and there's many, many jobs. And you know, one of the things they said to me is, we need more help with more jobs. So I said, let's train everybody. Let's get the women trained. Let's set up the programs. And so we continue to do more work. My team created something called Tech U, which is where we hire students right out of college, and we put them at a lower level to get them started, mentor them with some of our most senior technical leaders, and then we get them going much faster. So I want to be able to do like programs like this around the world so we can power missions much faster. So again, things like this, from human trafficking and child exploitation to education and training to conserving programs around the world that are needed, to heart disease, which you're going to hear about later. I mean, these are the things that technology can really do to move the mission faster. And we can solve problems like we've never done it before in the past. Now, I also want to make sure you guys take full advantage of this, because this is something we don't get to do very often, and I will tell you, we have done this only for this crowd, so I'm really excited about this. We have brought together many of the Amazon properties for you today to take advantage of, because we want you to be able to get technology, marketing, fundraising, merchandising, financial services, business needs taken care of. So we have kiosks set up all outside for you, and you're going to be hearing from a lot of these folks today. But we want you to be exposed to other tools that might support you from the Amazon family. So we have We Power Tech, which I forgot to bring my t-shirt out. Does somebody have theirs on? So We Power Tech is a program my group sponsors. There's Margie Wave. Margie runs our We Power Tech. Walk up here, Margie, so people can see you. We have a small group. Margie is a great background, Columbia University. We hired her about a year ago, and she's doing this. And We Power Tech is about diversity and inclusion. And so get a t-shirt, talk to Margie about We Power Tech. We want to get more women. We just need more diversity in technology. So we're running programs around the world again. So if you guys have ideas on what we can do more around We Power Tech. And then also we have our Amazon Cloud Credits for Research, which is providing support for those who are seeking new solutions to the world's most pressing problems, so you can apply for our credits. Amazon Business, which is really our B2B, so you can now, in the past, how you just went on Amazon.com and bought one or two things, you can buy Amazon for your business at scale. Amazon Pay, which is financial transactions. Local Love, which is what supports our volunteerism. AWS, which is near and dear to my heart. Amazon Smile, which is offering support of organizations. So if you go on Amazon, you can put your not-for-profit on, you can sign up as a not-for-profit, and then you can tell all of your supporters to go and mark you as their not-for-profit, and then a percentage of that purchase will go back to you, and that's called Amazon Smile. And then Merch by Amazon, which is merchandising, which helps scale your causes. Think of your conference t-shirt, which you'll all get a t-shirt. And thank you to Amazon Merch, who created our Imagine t-shirts. And then Amazon Media Group, which is supporting not-for-profits' mission through advertising, so they'll do ad-based programs. And then last but not least, but our Open Data is a happy data. So Open Data program, our Open Data team is here, and they'll talk to you about how you take advantage of your data. And again, Nancy, you're gonna hear from Nancy how we're doing that with the American Heart Association. So I'm really excited about this, guys, because literally it's the first time we have ever brought together all these groups for our customers. So I want your feedback, get to know them, and tell me if it was helpful or not. So, we share your goals, and we believe that technology can really play together in the mission. We want you to have all the resources you need at your fingertips, and we believe that technology is really going to power what you can do much faster. And we're going to be able to bring all these resources to bear to reverse the compounding effects that we see of violence, inequity, and perhaps the world's most things we're seeing around being just indifferent to lots of elements and issues happening around the world today and here in the US, as we see on a daily basis on the news. And at the heart of this is really, we want to be relentless with you on our approach together on solving these problems. We want to reshape the way we're driving this industry, and we can't do this alone. We have to do this with you, and we have to do this with your feedback. So again, let's collaborate, work together. I love our interactive sessions that we're having over the next couple of days. And I think through both our visions and strengths together, we can really come up with the right solutions that you need to power your mission on a much stronger basis. So again, I think we have a full agenda, but I'd love to see you all from 4:30 to 6:30, just to talk to each one of you and connect again. Make sure you hashtag, tweet out what we're doing, imagine a better world, and I will see you guys this afternoon. But before I jump off stage, I want to introduce to you one of the most amazing women in the world. Every time I see her, my heart jumps. She and I giggle and laugh and jump and say, here's what's happening, here's what's going on. Nancy Brown is the CEO of the American Heart Association. And I've got to just tell you a quick story about Nancy. I met her the first time about 2 years ago. And she came to us with a vision, and she's not a tech gal, but she's turned into one really fast. She came to us with a vision of innovation for the American Heart Association. And she said, look, if I'm gonna really achieve the goals that we need to achieve for American Heart, we've got to use technology. And we've got to bring the full power of a platform together to really look at every element of what we need to achieve these goals, and on a global scale, not just a local scale, but a global. So Nancy now, and working in partnership with Nancy, we've created a precision medicine platform, and I can think of no other leader that really has she's a pioneer and has the passion of probably 1 million people around the world, because she really does believe and want to change the course of what the American Heart Association is doing to cure the disease, which is still the #1 killer. So with that, please put your hands together and welcome Ms. Nancy Brown, the CEO of American Heart, to the stage.
Thank you, Teresa. Thank you so much, Teresa. And if you want an amazing person, that's the person right there, Teresa Carlson. I have to say, yay, Teresa, what an honor it is to be here, really to showcase some amazing work the American Heart Association and AWS, and really the full power of Amazon and what we're doing together. But before I jump into that, let me frame this a little bit about what's going on in the world that we live. And I'm going to start by the world that all of us live in together, and that is the opportunity we have every single day to work for and lead organizations that really have a purpose and a fundamental reason for existing that allow us to do things that many other organizations can't do. About 10 years ago, this book came out geared to the corporate market. It's not what you sell, it's what you stand for. And that was really at the time when for-profit businesses were focused on trying to define a purpose and their value in society. And I remember at that moment saying to myself, aren't we lucky to be part of this not-for-profit sector where every single day we work on behalf of a purpose, and we can really help lead this vision of President Kennedy, efforts and courage are not enough without purpose and direction. And so here we are, the not-for-profit sector, together with the amazing leaders of AWS to talk about how the world can be a different place when we match our mission and our purpose with the power of new technology. And that's exactly what we've done at the American Heart Association. Let me tell you a little bit about our mission and the problem that we're trying to solve, and that is that globally, 17.5 million people a year lose their life to some form of cardiovascular disease. And cardiovascular disease broadly is heart disease, stroke, peripheral vascular disease, hypertension. These are real killers that cause the #1 cause of death worldwide and here in the United States, and cripple many, many families. We also know that at the American Heart Association, we had to set a goal for the AHA to be able to combat this disease. And so we've been working toward reducing deaths from cardiovascular diseases by 20%, while improving health from cardiovascular health by 20% during the same time frame. And the reason we do that is exactly as I've said. It's because we're fighting the #1 killer. We know that every 2 seconds in this world, somebody's life is lost. And for all of us at the American Heart Association, that's a problem that has to be solved. A little about the global footprint of the AHA. We are a US-based organization, of course, as you would know by our name, but we have a presence in 80 countries, including 7 regional offices and dozens of employees who work on behalf of the AHA in global markets. So when we think about the problems we are trying to solve at the AHA, there are a few of them worth mentioning. First goes right on the point that Teresa was making, and this is eliminating disparities in health. Worldwide and certainly here in the United States, there are tremendous disparities. I often have a slide in my talks that shows a picture of any metropolitan market in the world. It could be Philadelphia, it could be a place in China, it could be a developed country, and it could be places right here in this community in Seattle. And you see these striking differences in life expectancy. For example, a person who lives in the French Quarter of New Orleans has a life expectancy of 55 years old, where an individual who lives 2 miles away in a more affluent area of the New Orleans community has a life expectancy of 85. That is not okay. And so we are doing everything we can at the American Heart Association to have an equity-first agenda where we are looking at what can we do to remove this inequitable access to healthy food, healthy places to exercise, access to essential medicines, the things that many of us take for granted. So that's a big thing that we are focused on. We are also focused on reducing risk factors that lead to poor health. And in many countries, especially developing countries and developed countries like the United States and many countries in Europe, because of medications and surgical procedures, there have been lots of cases where risk factors like high blood pressure, high cholesterol, that these things have been, in essence, managed. But when you look what's happening to the world's population today, this onset of type 2 diabetes and obesity that will cripple health systems, including our own here in the United States, because of the cost of managing those risk factors that ultimately will lead to people having heart attacks, stroke, dementia, early onset Alzheimer's, cancers, all of these diseases that none of us want to have to deal with. And so we must find ways, new ways, to help people manage their risk. And another thing we have to do is to modernize the way scientific research is conducted. Teresa spoke about this, and I'm going to give you a little more detail in a bit about the work we've done together, the American Heart Association and AWS, to create a state-of-the-art precision medicine platform. But what we know is that many people in science and research are still using old models when all of this new technology and new ways to collaborate in science and medicine are available. And so we've made it our goal at the AHA to try to showcase these new models and ways that this intersection of science and technology can truly transform scientific research. And so when we think about technology and innovative solutions that can change the world, we like to dream at the AHA, and we like to dream big, because we know that if we don't find ways to make these new technologies come into practice for patients and the public and the healthcare system and our governments, who's going to do it? And so we make it our mission to do that. And we do this in a world where traditional roles are rapidly changing. If you think about what it used to mean to be a patient and what's happening now because of technology that allows patients and consumers to really own their health and their health data. When you think about the old days of a physician singularly practicing in an office unattached to a broader healthcare system or a team of healthcare providers, and you look now at the team-based way that medicine is practiced, you look at care coordination, you look at the role of insurers and how insurers are using technology to create state-of-the-art analytics that can really make a difference in people's life of how much they're going to pay, whether they're going to have access, who will or won't be able to be approved for life-saving drugs like the PCSK9 inhibitor that can change people's lives if they have a familial hypercholesterolemia, as an example. We look at the role of pharma going from just creating drugs to providing therapeutic solutions, and certainly device companies doing the same. And so the world around us is changing very quickly. And globally, the world is connecting like never before. We know about mobile and how access to mobile has changed the world, and we all hear the statistics, how many people in the world have mobile phones, which is great. But access to the internet through the mobile devices will change everything. And we understand that there's a projection that there will be an increase from 48 to 60% between now and 2020 of these mobile devices having internet connectivity. And that will change the world for access to health and access to health information. And so we're thinking a lot at the AHA about what that means for our strategy. We all know about drones. We hear about Amazon's drones, as a matter of fact, not much, but we read about them in the paper. But you think about how drones are used. If you're buying a house and if you go on Zillow and you can see a picture of the house in the street, that drone technology and how that's happening. But if you live in the middle of an undeveloped country where you have no access to doctors or primary care, imagine how drone delivery of essential medicines could change health for an entire population. Imagine how you could reinvent a medical system in a country that doesn't have bricks and mortar, using drones and using technology to allow people to have a new and different way forward in their health. The virtual assistants like Alexa and others have really provided a new opportunity for two-way interaction around health and well-being. And we're using some of that in our vision for precision medicine in the future. But when we think about medication reminders, access to healthy ideas, ways that people can interact to record preferences and feelings as they're taking medication, this is cutting-edge stuff if we could capture it in a data format that would allow people to study that so that we could then tailor our approaches. We know that now 1 in 4 consumers own some sort of assisted virtual assistant, and that is exciting for the future of health and well-being in this country. And this idea of augmented reality is also really big. If you had a small child that had a congenital heart defect, and you think about the power of either 3D printing or augmented reality to allow a surgeon or a surgical team before your child had an incision so that a heart could be operated on. Imagine if there was a 3D printed heart in advance, because the size of a child's heart is the size of my thumb. And imagine what augmented reality does to allow surgeons to better interact with the areas that they're operating on. We think that this will change the way that medicine is practiced. And at the AHA, again, we're thinking about how that will change the way we think about training the next generation of physicians and scientists as well. And as Teresa mentioned, science is becoming open. And at the AHA, we are so proud that we have held this as as a principle in our organization for over a decade. We were one of the first health organizations in America and probably in the world to require data that be shared in an open way from research grants that we gave. We have really pushed our own federal government to make sure that data is open. And we had one of the first open access journals to allow people to share information with light peer review instead of the normal kind of peer review that happens in a scientific journal. And so when we think about science and data becoming open and all of those trends that I mentioned before, I will build on Teresa's theme of imagine if. You know, imagine if is a wonderful way to think about futures of all of our organizations. And so I like to imagine, you know, imagine if every person in the world received the highest quality health care regardless of where they lived. How could technology help us reduce those disparities that I spoke of earlier? Imagine if your cellular phone could become an automated external defibrillator. Here's a statistic that is shocking but important to know. In the United States alone last year, 400,000 people were living their life and collapsed from a sudden cardiac arrest. That's an electrical malfunction in your heart, not clogged arteries, but an electrical malfunction in your heart. Only 70,000 of those people are alive today. Why? Because they didn't have access, perhaps. There was not someone there to give them CPR and no access to a defibrillator. If the phone could become a defibrillator, we wouldn't have that problem, and people who are living without their loved ones today would have their loved ones with them. You know, imagine if the medicine that you took was personalized for you. I often like to give this example when people say, what does precision medicine really mean? And what precision medicine really means is that your care and treatment, including your medications, are appropriate for you and your biology and your genetics and the environment that you live in. When you go to the eye doctor, you generally walk away with a set of eyeglasses that allow you magically to see because there's a prescription that has been developed exactly for you. But when you have high blood pressure, the leading risk factor in the world for that cripple so many people and cause heart attacks and strokes and early onset Alzheimer's and dementia, there is a period of if you even have access to the drugs, first of all, there's a period of trial and error to figure out which combination of drugs are going to work for you. And for many people, the side effects of blood pressure medication make them feel worse than they did before because we call blood pressure, elevated blood pressure, the silent killer. A lot of times you don't even know your blood pressure is elevated. So for some people, it's easier to walk around with elevated blood pressure than to have the side effects of medication until, of course, you drop over from a stroke or a heart attack. And so with the focus on precision medicine, it is finding the right treatment at the right time for the right patient. And if we could really make this happen in cardiovascular diseases, we would change the world and change lives for so many people. You know, imagine if nanobots in your blood could alert you to a cardiovascular event before it happened. There are people working on this research right now. You know, there are so many smart people, because they are also not just great scientists, but they understand and know how to use technology, that are creating these little sensors that will give you these early warning signs that you're about to have a heart attack. Or imagine if your clothes, your home, your office, or your car allowed you to monitor your cardiovascular health status. Just last week, we were on the phone with a leading manufacturer of automobiles. And this is public knowledge because it's been in the newspaper, but this auto company is looking at how to use sensing devices, not just to help people know if they're in and out of the wrong lane, and not just to help people track their kids who might have their car, but to actually track how a person's body chemistry and a person's body temperature and those kinds of things are changing while they're in an automobile. And imagine how that could change life for so many people who might be driving as they're having a heart attack or a stroke or some other health episode. And so we look at all of these things together and say these new ways of monitoring health status through the use of technology and the intersection of that technology with brilliant scientists who know how to bring it all together could truly change the world. And to my point about lack of access to healthcare or lack of access to specialists, imagine if you could see any doctor in the entire world through a visit that was done via a hologram. Now, even here in the United States, people in rural communities who suffer devastating events do not often have access to state-of-the-art specialists. So you hear a lot about telemedicine. We've done some of the pioneering work in telemedicine in stroke. As an aside, if a person is having a stroke caused by a blood clot in the brain, if the miracle drug TPA is administered in a 90-minute window, that person will walk out of the hospital in days as if the stroke never happened. Now there are these new clot retrievers. Again, it requires the stroke to be diagnosed early. And so it's great. It's not great, but if you have a stroke, it is more fortunate for you if you have the stroke in a major city. Right here in Seattle, I'm sure that there are certified comprehensive stroke centers ready to use these state-of-the-art techniques. But if you're in a rural area, you may not be 90 minutes near a physician that's able to diagnose this. Or even if you have a simple health problem, imagine how your life could be changed if all of this new technology could allow you access to any healthcare provider in the world. And so at the American Heart Association, we think about all of this possibility and how will it help us achieve our bold goals for the future. And I don't just mean this year, I mean now and the next 10 years. And so the strategic focus areas of the AHA include accelerating science through technology, transforming communities where so many disparities in access to health and healthcare and healthy places to live are so visible in this country and in this world. We want to improve systems of care so that people can get to the right healthcare system at the right time. And we want to empower consumers so that they can be focused on overall health and well-being. And these are really the things that we're doing at the American Heart Association today. And we do these by focusing on the things that we believe differentiate us from any other organization in the world that is trying to solve these problems. And that is the brand of the American Heart Association, almost a 100-year-old brand, positively recognized by 95% of the American public, our science and our grassroots. And it's really the combination of those together that allow us to deliver these new solutions that can change the world for people. And today, I'm so proud to be able to showcase some of the solutions we've created together with AWS that truly are changing the world. We have, to use Teresa's word, looked at the full set of possibilities of the resources AWS and Amazon have available, and we've been bold to invest in these solutions at the AHA because we know they will help us capitalize on the trends in technology and meet the aggressive goals and help reduce the numbers that I mentioned earlier. And the first is our precision medicine platform that Teresa referenced. You know, we did have a vision 2 years ago as we created our Institute for Precision Medicine at the American Heart Association, and we thought about how can we make the biggest difference in helping scientists have access to data that can result in individual patients and consumers having the right treatment at the right time. And we recognized the single biggest obstacle was access to data. I love the open data buttons. If I didn't have a leather jacket on, I would pin it on, but I'll put it on my name tag a little bit later. Data in science is very interesting. People have built their careers running studies, running clinical trials. Healthcare systems have enormous data in electronic health records. And people are really hesitant to share it with each other. You know, as an example, if I were Bank of America and you were Wells Fargo and you were Comerica Bank, there probably isn't a lot to inspire us to decide to share our data for the overall health and well-being of customers who are making decisions about where to bank. But we're not talking about banking. We're talking about people's lives. And so we've recognized at the AHA we play an important role as an honest broker, if you will, and all of us in the not-for-profit sector can play that role to help inspire people to bring together data that's never been shared before. And so that was our vision when we created the Precision Medicine platform. We worked kind of behind the scenes on this platform for about a year. We announced it and launched it in November. We went into a small window of time, a 4-month period of time where we did a lot of user experience testing. We were testing onboarding data sets. And so here we are, not even a year from when we announced this platform. And I'm so proud to say that we now have 37 million pieces of data on this platform, 37 million pieces of data. And this data are data about individuals and their health status. They can come from clinical trials. They might come from these long-term longitudinal studies where people have been followed. And we've created 84 analytical tools that allow a scientist or a researcher to go into this platform and search and discover among and across the data sets to create a custom study, if you will. Now, in the old days, before we invested with AWS in building this platform, if I wanted to study individuals between the age of 40 and 50 who were African American, who lived in the South, and who had a heart attack with a mother who had a stroke, I could spend 5 years going around and talking to the people who ran the studies to try to get them to create sub-studies to bring that data together so that I could have access to it. And maybe I would get it. But without the power of cloud computing and without the power of this community we've built, we're talking about the difference of 5 years and simple clicks in this precision medicine platform. And so now the people that are using this platform, and we've inspired it through giving data grants, AHA and AWS together, to help create some of these analytical tools, people will have access to data like this. And when they have access to data, they will be able to study differences and similarities in ways that have never been done before. And that's what it's going to take to get to precision medicine. And so we have a dream and a vision that this precision medicine platform will transform not only how patients and the public who are concerned about heart attack, stroke, vascular disease, early onset dementia, obesity, and all the things we care about, but imagine if we could make this platform available to other organizations and other disease states, how the entire world of scientific research can be transformed forever. And the AHA and AWS did this together in under 2 years, and I couldn't be more proud. I'm also really proud about how we're using Alexa. We're looking at Alexa as we encourage patients and regular citizens to donate data to the American Heart Association so that we can study individual behaviors. And as I mentioned earlier, Alexa will change the way that information can be gathered, and it will allow ultimately and over time for a two-way conversation. We also have, with the work of Alexa, have trained Alexa on skills. And so that if someone is having a heart attack or a stroke, they're able to, or they think they might be, they're able to communicate via Alexa to understand the warning signs of a heart attack or a stroke. And so these skills that Alexa can learn can change people's lives forever. We also are using Lex for our Heart Walk. So at the American Heart Association, I've talked a lot about our science and our work in eliminating disparities, but we are a philanthropy. We exist because of the generosity of people who care deeply about our mission and who want a world free of people dying too early from heart attacks and strokes. And so Lex has helped us with our Heart Walk. Our Heart Walk is an event that is conducted in communities throughout America. One of the things we recognized is that the technology we were using, although great, once a person has been registered to help them raise donations from friends and family, we had a very antiquated way for people to register for the walk. And so in comes the partnership between AWS and the American Heart Association, and now Lex is helping us register people for the Heart Walk. Lex is now a tool that will allow that to be seamless so that people can come in. And for us at the HA, the Heart Walk is $110 million a year in revenue, and we need it to be $250 million a year in revenue, and so we have to use every piece of technology possible to make the user experience better. I've mentioned a bit about individuals donating data for research. So My Research Legacy is a platform that we've built that allows individuals to say, you know what, I would like my data to be used for scientific research. A great example, people always jump to their genetic data and privacy, which all of us should be worried about. So the data comes in a de-identified way. And genetic data is really important, especially as we're studying, for example, people under the age of 50 who've had a heart attack or a stroke. It's really important to know how genetics have played into that. But on the other hand, all of us could be contributing our data, because wouldn't it be great to have answers for once and for all about what kind of diet will allow you to have the healthiest life possible. And so we're thinking about how My Research Legacy can help power one of the largest nutrition studies ever funded in this country to examine the Mediterranean diet versus other kinds of diet. And that takes a lot of people being willing to participate and use technology that can populate My Research Legacy and then ultimately populate our precision medicine platform. And we can answer these questions because of technology, because of cloud computing, and because of this intersection of the minds of people at AWS and the minds of people at the American Heart Association. And so in closing, I would just like to, again, thank Teresa and the entire AWS team for this moment to spotlight the work that we're doing together, this moment to hopefully enroll and educate all of you about this worldwide mission that we're on at the American Heart Association. Because at the end of the day, we really exist to give people trust and to give people hope. And this focus on giving people trust and hope can be accelerated so much more quickly when we think about how state-of-the-art technology can help state-of-the-art science come to life for all of us. Thank you very much, and I think we have a few minutes for questions if anyone has any. We can, I'd be happy to take them. Is that correct, Doug and Teresa? That is correct. Okay. Any questions? If you have any, you can go right to the microphone. Any questions? Yeah, could you go to the microphone because they're taping this, so we need to be able to hear it. Thank you.
You know, one of the questions I have for you is I work with kids in jail, and there are 66,000 kids in jail in America. And I do that as a chaplain, but one of the things I've noticed when I've eaten food with them, when I've seen the medication, do you all do any projects right now? Because a lot of the stuff that you're talking about, I mean, think about that, 66,000 kids, there's a population that's getting horrible food, they're in emotional crisis, and I'm just wondering if you've done any studies in that neck of the woods.
Yeah, it's a really important question. You know, one of the partnerships we're really proud of at the American Heart Association that is 10 years old now is our partnership with the Clinton Foundation. You might recall that former President Clinton, you know, has had his own share of heart issues over time. And so shortly after his second heart attack and surgery, we formed an alliance together called the Alliance for a Healthier Generation, focused on this epidemic of adverse events that impact children. And one of the big focus areas of Chelsea Clinton is this idea and this focus on thinking about children who are in those juvenile justice systems and how we might take the assets of the American Heart Association and the Alliance into those settings. And so this is an area that we have talked about. We certainly are doing some pilots through the Alliance for a Healthier Generation, but we are not accessing all 66,000. That's a startling number that I didn't know until you mentioned it. So thank you, and we will try to find a way, because I agree with you. You know, every child, no matter what their situation, deserves the right to have access to healthy food, access to essential medicines, because if not, these are just problems that we're going to have later down the road. Thank you for that startling number.
Nancy, we have another question over here.
Okay.
Hi, my name is Chris Bryan. I'm with Operation Smile. We actually partner with you guys to do life-saving certifications in countries around the world. My question is about investment. So there's lots of opportunity in technology. It requires money. So what are your thoughts about strategy to rally your organization around how to invest and get the money to make these things happen?
Yeah. Well, you know, for us at the AHA, we are if we were doing no investments in technology, it is easy for us to say, boy, we have to in this particular area. So our science enterprise is a great example. In the scientific enterprise of the American Heart Association, we grant out to external organizations around between $150 and $180 million a year. So when we recognized the problem with science is that this access to data isn't there. It was a very easy decision. Once there was a vision, once Teresa and I came together and we had this vision, it was easy for our board to see how this investment could accelerate and really multiply the effect of the other money we were already spending. And I think that's really what I have found has been the key. The board of directors of the AHA is inspired by these solutions, and they see the same things we see, you know, in terms of how people's lives are changing through technology. And I can assure you, at least in my organization, if I wasn't bringing them ideas, they would be bringing them to me, and that's really, you know, that's really a way that we work together. All right, I think that's it. Thank you so very much. I look forward to meeting all of you at the reception later. Thank you.